Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Dr. Ann Kayla Garbo, Chief Medical Director for United Healthcare Community Plan of Louisiana, who will discuss Louisiana's birth outcomes, teen pregnancy, sexually transmitted diseases, and the young women at risk and the relevant solutions United Healthcare and its statewide community partners are formulating to help improve the health of women and babies in our state. Ellie Thomas of Fresh Bar on Magazine Street in Uptown New Orleans, who will talk about her restaurant's participation in Ochsner's Elmwood Fitness Eat Fit NOLA program. And Tricia Davis, Heart Walk Director for the American Heart Association, who will discuss their free Survivor Soiree picnic coming up on Sunday, August 24th at Audubon Park. So don't go away. We'll be right back with more Community Health Heroes.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Each year, loving parents and caregivers cause serious injury and even death to infants by allowing unsafe sleeping conditions. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Don't allow the baby you love to be the next tragic statistic. The only safe place for your baby to sleep is on its back in a crib. For more information, visit cribsforkids.org.
United Healthcare Community Plan of Louisiana and 22 faith and community-based organizations, outreach providers, state agencies, and healthcare providers are currently sharing ideas and identifying resources that can be accessed to help improve the health of young women and babies in our state. Joining us today to talk about these important health issues is Dr. Ann Kayla Garbo, Chief Medical Director for United Healthcare Community Plan of Louisiana. Thank you for being on the show today, Dr. LaGarbo.
Thank you.
Can you tell me a little bit about the issues that women face with health situations and testing?
Sure. Well, in Louisiana, of course, we share some health issues with men, obesity, hypertension, heart disease, and the complications thereof. But specific for Louisiana, we've got issues with sexually transmitted diseases like chlamydia, which is on the rise, preterm birth, and the complications of young moms delivering.
Well, on that same topic, can you tell me a little bit about why we have such a high rate of teen pregnancy in Louisiana?
You know, it is area specific, and it does appear to be primarily in the north, across the state, of course, but primarily in the north of Louisiana. And living in rural areas, as wonderful as it is, growing up in a rural area, it's got some drawbacks, and some of the drawbacks that I think contribute to the preterm birth are going to be the rural nature of North Louisiana. So there's limited access easily to physicians providing the care. Education is an issue. It's always an issue. It's always been an issue. Transportation can be an issue when you don't have a mode of transportation and your obstetric physician is an hour and a half away.
So, Dr. LaGarbo, we rank 7th in teen pregnancy. Is teen pregnancy also associated with preterm labor?
Absolutely. The younger the mother, the older the mother, the more likely they are to have maternal complications. And in our young mothers that are delivering, they many times don't know that they need to seek obstetric care at the beginning of the notification of the pregnancy.
And then throughout the entire pregnancy?
Throughout the entire pregnancy, of course.
That's really interesting. Dr. LaGarbo, can you tell me what Louisiana and United Healthcare is doing to help prevent preterm birth?
Absolutely. Well, as many people know, the 2013 March of Dimes report card for preterm birth in Louisiana was sadly an F. And so we have identified that we do have an issue with preterm birth. We are working with the Department of Health and Hospitals and all the hospitals across the state on a 39-week initiative where we are encouraging delivery less than 39 weeks, only for medical indications, because we know babies that are delivered preterm are at much greater risk for complications, medical complications, and of course, as the mother is.
Okay. And can you also tell me how preterm birth is associated with teenage pregnancy?
Yes, in Louisiana, particularly in our rural areas, we have a very high percentage of young mothers delivering, and young mothers, as well as older mothers over 40, have a high percentage of early delivery. Early delivery means babies are not ready, they're in the NICU for long stays, lots of complications, and of course any early delivery for the mother is going to put her at risk also.
And some of the complications are preventable, are not preventable, but are reversible, and some of them aren't.
Some of them are reversible, some of them are not reversible. Depending on how early the baby is, there can be some neurological sequela that even with the best of therapies is not going to completely disappear. There could be some respiratory complications that will improve with age, depending on the actual age of the preterm birth.
And then compared to a normal birth, the length of stay in the hospital is very prolonged for a preterm
Very
baby.
prolonged. The average NICU stay in Louisiana is somewhere between 12 and 16 days, and that is not good. It's not good. You know, we need to get those babies down to where they are born as close to term as possible, those that can be prevented, and as healthy as possible to get that NICU stay down to what the national average is.
Okay, appreciate that. And switching gears a little bit, Louisiana also has, and you mentioned it earlier, a really high rate of sexually transmitted diseases.
We
Can
do.
you explain about that?
We do. And one of the silent sexually transmitted diseases is chlamydia. It's something that is not very well known, and it's something that's not brought up regularly in the doctor's office. And many of these screens should be done in the pediatric offices, because we're talking about teenage screening for sexually transmitted diseases. It's a difficult topic to bring up to a parent, to tell them that you'd like to screen their child, their teenage child, for sexually transmitted disease. But the consequences of an untreated sexually transmitted disease, such as chlamydia, can be infertility later on in life. When they're ready to have children, when they're contemplating having children, untreated chlamydia can actually lead to infertility.
There are some signs and symptoms with some people with chlamydia. Can you
There
discuss
are.
that?
Even though it tends to be a silent sexually transmitted disease, most people do present with some type of vaginal or penile discharge, or even some pain or discomfort in the pubic area.
And what can either a pediatrician or the state of Louisiana do about preventing or treating chlamydia?
Screening is the key. And the screening test for chlamydia is an easy urine test that can be done in the doctor's office. And once a person is screened for chlamydia, then the appropriate treatment is not only to treat that individual, but to treat the sexual partners also.
Okay, I appreciate that information. And switching gears kind of again, can you tell me what United Healthcare is doing with the faith-based and community-based organizations?
So we're focusing across the state, but with some interest in North Louisiana, where we have the highest risk of young moms delivering, where we have the highest percentage of young moms delivering, and the greatest risk of preterm birth. And so we are actually right now holding some stakeholder meetings and educational meetings in the Northeast Louisiana region, bringing together their thoughts and ideas on what the appropriate next action would be, whether it be intense education, whether it be working throughout the faith-based centers in order to spread the knowledge and the education needed to get these young moms into care.
So is it focusing just on the teen pregnancy, or is it focusing on everything that we've talked about?
It's really focusing on everything that we've talked about. And so we're actually going to be having our second round, collecting right now the data from a survey to the stakeholders that we met with several months ago. And the next stage is going to be to help them focus their efforts on community grants that United Healthcare provides so that we can work together to partner in their communities and try to make this a better situation.
So it's mostly going to be education-based?
It's going to be education-based. However, we're looking at getting some community health workers, people on the ground, to go visit the areas and bring the knowledge to them directly.
And are schools participating too, or mostly?
We hope to. We hope to. We're going to attack that through our stakeholders, because we had stakeholders from the school-based systems and the federally qualified health centers, which is very important in the rural areas.
Well, this has been very valuable information. Is there anything else you'd like to share with us?
There is. We have a tremendous site, www.uhccommunityplan.com/grants, and anyone is welcome to go to that website. You can sign up for weekly webinars that are held on the second Wednesday of every month from 11 to noon. You can get information mailed to you. Through the webinars, we help people learn to write grants. We teach them how to write grants to get some of the monies that are out there by United Healthcare Community Plan to put back into their communities and work with us to help solving these issues.
To partner with United Healthcare?
Absolutely.
Well, I really appreciate the time you took to come to the show today.
Thank you for having me.
And we'll be right back with more Community Health Heroes.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards!
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
New Orleans is known for its delicious food, but dining at your favorite restaurant doesn't have to mean ditching your otherwise healthy diet. And making smart menu choices certainly doesn't mean you have to order grilled chicken over lettuce every time you dine out. Molly Kimball, registered dietitian with Ochsner's Elmwood Fitness Center, has collaborated with local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right on the menu, making it effortless for anyone to eat nutritiously anywhere in the city. Joining us today to talk about the healthy Eat Fit NOLA dishes featured at her Magazine Street restaurant is Ellie Thomas, owner of Fresh Bar. Welcome to the show, Ellie. Can you tell me about some of this beautiful food that you've put out in front of us?
So these are some salads that we offer at Fresh Bar that are part of the Eat Fit NOLA program. Over here, the already made one is our Healthy Tex-Mex, and that one has lots of fresh veggies, some chicken, so extra protein. It's got some black beans in it. So you're really getting all your protein, all of your veggies, and all your greens. This is under 500 calories, including the dressing, which that one comes with the Chipotle dressing, so you've got a little kick. It's delicious. That's one of our favorites. And you're really getting your full meal in this one salad bowl. So that one's really great. And then I'm gonna make our other favorite off the Eat Fit NOLA menu, and that's the light fruity. So that one also has a little bit of chicken in it, so you're getting your protein there. Some fresh strawberries, and some almonds. Get some little nuts in there, and a little bit of goat cheese. And
now, I was asking earlier, that looks like an awful large amount of salad dressing.
Oh, yes.
How do you measure and?
So our regular portion for all of our dressings is 2 ounces. So this is well over 2 ounces, but I just do like a little spread on there. And this is the way you would get served at Fresh Bar. It's all kind of made in front of you, made to order, so you are also able to customize anything. You're able to modify our menu if you want something a little bit different.
So like if you had like a nut allergy, you can say hold the nuts.
Absolutely, and you can switch out anything, and it's all tossed up for you and packaged in our recyclable packaging. And we offer salads, wraps, and soups, and we're just starting to get into juices too. So it really emphasizes the healthy eating light. And especially with the Eat Fit NOLA program, it's really great to give people real healthy, really straightforward, knowing what kind of, it's not always about calories. Mm-hmm. Sometimes it's about the sugars and the carbs and things like that. So. And
how did you get involved in Eat Fit NOLA?
I met Molly through a mutual friend, and she immediately jumped on board with, Fresh Bar is a healthy concept anyway. And so she took her team and did an analysis of our entire menu and pointed out, kind of built their own Eat Fit salads. So I think we were one of the first ones to get involved whenever she started the program, and it's grown into this huge thing now across the city. And any restaurant is able to get involved, which is great. It's free. She does really great with the marketing and the promoting of every restaurant that's involved. There's a lot of events and things like that. So it's really, I encourage every restaurant to get involved with it because it's a win-win.
And at Fresh Bar, how many items are marked Eat Fit NOLA, and how do the customers know that they are part of that program?
So we have 4 items. They can be made salads or wraps that are part of the Eat Fit program. They're marked with a little seal of approval from Ochsner. It's a little gold seal. So we have like a whole separate menu area for that, but at any other restaurant, they're just marked with the seal of approval along their menu. So it's identified, it's easy, people can just walk in and say, I want this. And you know you're getting something real healthy.
And can you tell me a little bit more, what guidelines did the Eat Fit NOLA follow?
So the Eat Fit program follows the American Heart Association's upper limits for sodium and saturated fat, and it also takes it even further with no white carbs and less than a teaspoon of added sugar.
Well, that's awesome. I'm looking forward to seeing more restaurants with this on their menu.
Yes, absolutely. I think the program will only get bigger, so I encourage everyone to get involved.
Is there anything else you'd like to share with us today?
Come visit us at Fresh Bar. We're at 6101 Magazine, and we're right near Audubon Park, so you can spend a great day in the park and then come stop by us for lunch and then stroll along Magazine.
Well, thank you for making us this delicious salad and being on our show today.
Absolutely. Thank you for having me.
Eat Fit NOLA is a proud partner of Fit NOLA, which was launched by the City of New Orleans in 2012 and was developed with broad community input. It provides a roadmap for our community to reach our goal of improving the physical and nutritional fitness for those who live, learn, work, and play in New Orleans. Join us next month when we feature another fantastic local restaurant offering Eat Fit NOLA options. We'll be right back with more Community Health Heroes.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer.
Live United. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
So this is my computer?
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. Pressing down, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
Did you know that heart disease is the #1 killer in Louisiana and strokes is the #4 killer? But in spite of these very serious statistics, with the help of the American Heart Association, many people are eating better and exercising more. So now there are more survivors in our community than ever. Here to tell us about a very special free event to celebrate our community's heart disease and stroke survivors is Tricia Davis, Heart Walk Director for the American Heart Association. Welcome to the show, Tricia.
Thank you for having me.
Can you tell me about the great events that the American Heart Association is doing here in New Orleans?
Certainly. Well, heart disease is the #1 killer and stroke is the #4 killer in the nation, so we definitely have our work cut out for us. That equates to about 12,000 Louisianians each year dying of heart disease. So we're very active in the community of having events that not only generate awareness about the prevalence of those two diseases, but also raise money to prevent those diseases and put towards local research just here in the New Orleans market.
Like what kind of resources is the money put towards?
It goes towards CPR training throughout the state. We also fund currently a little over $3 million in research grants to our local teaching hospitals. We work with other hospitals through our Get With The Guidelines programs to make sure that patients are seen in the right amount of time and treated properly. We go into the local schools through our Jump Rope for Heart and our Hoops for Heart program to make sure children are staying active and healthy and eating healthy. We also have teaching gardens that we do in other elementary schools where there's a whole curriculum behind it to, again, teach children the importance of living a healthy lifestyle. And we're very involved in our advocacy efforts.
And you have an upcoming event that's going to be at Audubon Park soon, right?
Yes, it's the Survivor Soiree. It's Sunday, August 24th, and it's an event that we have for all of our local heart and stroke survivors, along with their caregivers and their friends and family, to come out and just enjoy a free day at the zoo, along with having a free lunch.
And why is that event so important to the American Heart Association and the community?
Well, about over 12,000 Louisianians die each year of heart disease and stroke, so it's important for us to build a community of these survivors and really celebrate their life, of the struggles that they've been going through, and give them just one day to kind of share their stories with one another and just enjoy a fun day at the zoo.
And if our community wanted to find out more about this event, how would they do that?
They could go to neworleansheartwalk.org, and there's information right there on the front page of the website.
And do you have any other events that are coming up, or that are annual events for American Heart Association?
Yes, we do. We have the New Orleans Heart Walk, which is Saturday, November 15th, out at LaSalle Park, and it's free to come out and just walk. It's a 1.8-mile loop, and again, it's just generating awareness for people to get active and live healthy lives.
Tricia, how is American Heart Association able to put on such events like the Survivor Soiree?
We're lucky to have generous community support. For instance, Harvey Gulf International Marine is our sponsor for the Survivor Soiree, so they're the reason that we're able to invite the survivors and their friends and family to come and have a free day at the zoo.
And will there be some education materials available at that event?
Yes, there will be several education materials, both targeted towards children and targeted towards adults.
And if somebody wanted to live a healthier lifestyle, where would they go for that information?
They could go to heart.org, and we have tons of information on even how to jumpstart your exercise program and healthy recipes and just tips to, again, embrace a healthier lifestyle.
Is there anything else you'd like to share with us today, Tricia?
No, I just want to thank you for having me today, and please come to the Survivor Soiree Sunday, August 24th.
Well, I appreciate you being on the show today and providing this valuable information for us.
Thank you so much.
And we'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but But the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic or send us information on your health organization's events, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our new website at communityhealthheroes.org. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.